Okay, welcome everyone. My name is Wessel van den Berg from Sonke Gender Justice, and this is the State of the World's Fathers webinar on how to use the State of the World's Fathers report for national advocacy and action. We'll start in about a half a minute or a minute or so from now. We're just waiting for some people to join. It looks like our attendee count is pretty good already. But I'll just give it another half a minute or so and then we'll begin. Thank you so much for those that have signed on so far. Okay, so greetings everybody. It looks like our attendee number is stabilized, so I'm really happy to welcome all of you to this webinar on how to use the State of the World's Fathers report for national advocacy and action. My name is Wessel van den Berg. I am one of the MenCare Global Campaign co-coordinators, along with my colleague Aapta Garg from Promundo-US. And Aapta, you want to say a few words just to also welcome everyone?
Sure, thanks, Wessel. Hi, everyone. My name is Aapta Garg. I'm a program officer with Promundo and a co-coordinator of the MenCare campaign alongside Wessel. Thank you all for joining us today. We're very excited to be here with you and to share this all with you. And for those of you who will be at Women Delivered to see the launch, we look forward to seeing you in person. And for those who won't be, we'll be looking forward to seeing you and talking with you and staying in touch with you as this amazing report is launched and we get to kind of progress with it going forward. Thanks, everyone.
Thank you, Aapta. So the objectives of this webinar is to really inspire all of you and other colleagues around the world to use the State of the World's Fathers Report 2019 that's due to be launched on June 5th at the Women Deliver Conference in Vancouver. And this webinar will really help all of you and those who listen to it once it's recorded to learn from some of the examples of how the previous State of the World's Fathers reports have been used. I've got one or two housekeeping notes before we begin with the presentations. The first one is just to say that we do plan to record the session, but we will only post it online after the global launch, which is on June the 5th, since we do have some information that will be shared from the report. And then also you will see on your Zoom window that there's a Q&A box. So we welcome you to post questions as the presenters are presenting, because we will have a moderated question and answer session at the end, and it's really useful to already have some questions posted. So no need to note them down, just post them there and we'll revisit them when we come back to them at the end. So yeah, I'd really like to welcome in general. I'll introduce each speaker in specific, but thank you so much to all of our panelists, to Brian, Alexa, Douglas, Tomas, Miguel, and Kate. But I will also be able to introduce each participant or each panelist in detail when they do their presentations. So let me begin by handing over to Brian Heilman, who will talk to us about the State of the World's Fathers Report 2019. And Brian is the Senior Research Officer from Promundo-US, who has led on the State of the World's Fathers Report. Over to you, Brian. Brian?
I'm so sorry. I unmuted on my phone, but not on the screen. Can you hear me now, Vessel?
Yes, that's fine. Thank you, Brian.
Please good. Thank you so much for the kind introduction. Sorry for the awkward silence just there as I was talking to myself, I guess. Vessel, if you move to the next slide. Thanks. So yeah, for any attendees who aren't aware, as we are preparing to launch the 2019 version of the State of the World's Fathers, it's actually the third edition of this report that we have produced. So as a basic introduction to what this report and this project are all about, I want to make sure you have a view and have access to the prior editions of the report as well. So in 2015, we launched the initial version of this report, which you see on the left-hand side of the slide. And this one was a truly landmark publication. It's the biggest, longest edition that we have published to date. It's really, as the title suggests, a state of data and trends and information from the world and on progress toward men and women taking on equal care work in the home and in society. Then in 2017, we thought, okay, we did such a huge effort to produce this big report a couple of years ago. Let's do a much thinner volume and focus very specifically on the actions that we're calling for. So the 2017 version is a little bit more bite-sized and focuses in on the key recommendations. And so then we were set up for 2019. Oh, sorry, just click one more slide then, if you could, Wessel. So as we go into 2019 and launching a new version of the report, we have already achieved such great reach and impact through the first editions of the report. So as you can see on this slide, and as we'll discuss later on in this panel, those first two editions of the report have informed debates and even in some cases new policies around parental leave in places as wide-ranging as the Netherlands, which we'll hear about today, South Africa. Also in Washington, D.C., with our city council here where Promundo is based, we were able to leverage the results. The launch events have taken place at the United Nations in New York and Geneva, as well as many other places. And I mean, an important point to make here at the third bullet point is even though there are those two global reports that I emphasize, those reports have also been translated themselves into 6 languages, and our MenCare campaign partners have been so energetic and enterprising and taken inspiration from the reports to create their own either country version or regional versions of the report. And you know, Wessel on the call and Kate from Rutgers and others who you'll hear from today are examples who have done that kind of work. We've also been pretty impressed by the news pickup and the media and social media clicks around the report. So it really does have a wide platform. So we'll just keep going now. We can get to the 2019 version. Here is your sneak preview of the cover of the new report. So this one will slot in just to the right of those other 2 cover images as we continue to build this out. And we're very excited that in this year's version, we have some exciting new sources of data. It's not always the case that the State of the World's Fathers is connected with completely new data that haven't been published anywhere before, but we are lucky enough that that is the case this year. So with support from our partners at Unilever and the Dove Men Plus Care brand, we actually conducted surveys under something called the Helping Dads Care Research Project in 7 countries over the past couple of years. And this data is to understand the norms around care work, equality of care, and especially the norms either in support of or pushing back against men taking leave, taking on fully equal care roles in the home, whether coming from their colleagues, from their friends, from their partners themselves, from society. So we'll be presenting those data throughout the report. We also have a very generous contribution from our partners at Plan International Canada, who conducted specific, really rich focus group conversations with participants in their fathers clubs in 3 or 4 countries around the world, and also the female partners of men who participated in the fathers clubs. And so they've written these brilliant qualitative passages showing the particular realities of fathers who are going through these transformations and the women and girls in their lives. We've also conducted some new analyses of what now is a very rich database of over 40 countries of images or images inspired survey data sets from around the world. That's the International Men and Gender Equality Survey that Promundo and our partners at International Center for Research on Women and all sorts of partners around the world have undertaken so far. We've done some new multi-country analyses for this report. And we also worked closely with partners at OECD to present some new data from their gender index, the SIGI index. So you'll see some of those data as well. And the way we've organized the report is into something we're calling kind of the central image or metaphor of the whole report, is the 5 keys to unlock the power of care. And what are these 5 keys? We'll just give you a sneak preview of the image of how we organize them. The keys are as follows on this slide, and as you can see from the way they're visualized, the keys kind of moved from the broadest, biggest level in society, level by level down to the individual father. So this is, for those of you familiar with kind of sociological literature, basically we've used the ecological model as an organizer for the whole report, but we've tried not to use so much sociology language in the report, and instead we're just talking about the 5 keys that kind of go from the biggest level of society down to an individual father. And those keys, as you can see at the broadest level, relate to the improvements we need in laws and policies. Number 2, down to that level of what do your friends and family members and colleagues and just the society around you, those messages about what men and women should be doing. We need transformations in those social and gender norms. Then down one more step to the family level is the 3rd key. Within the family, there's so much we need to think about guaranteeing the economic security and the physical security of families when we're talking about equality in care work. And that includes poverty, that includes ongoing political conflicts and violence around the world. And then step 4 is within a couple or within a set of co-parents themselves. How does their cooperation work? How does decision-making work? What do women really say that they want out of fathers? That's a focus of that particular chapter. And then 5th and finally, we talk about, of course, the individual father and how he needs to ultimately step up within his reality if all those other levels are also working in harmony to take on more care work. And we talk about some of the intergenerational factors that influence that and men's feelings about their own confidence and skills related to care work. And then to close, my final slide, we've also bring everything home at the end of the report this time around with something that we're calling the MenCare Commitment. And we're really hoping to use this commitment language and this phrase to inspire ongoing advocacy in the months and years to follow. And the kind of catchphrase of the commitment is 50 minutes, 50%. And I like to think of that 50 minutes as kind of the side of the commitment that relates more to the inner circles of that sociological diagram we just saw, where we actually took some OECD data and analyzed that discrepancy between the amount of unpaid care and domestic work that women and men are doing on a daily basis and found it to be about 1 hour and 40 minutes. And so if we took 1 hour and 40 minutes and said, all right, that is way too big of a discrepancy, what that means on average worldwide is that men are doing 50 minutes too few and women are doing 50 minutes too much to have truly equal sharing of that work. And so let's try to have a conversation as individuals, as couples, as families about what can we do for men to take on 50 minutes more and for us to give 50 minutes at least per day back to women to do what they would want to do. With that time, other than an unequal burden of care work. I shouldn't say a burden, unequal amount of care responsibilities. And then the 50% side of it is looking up to those social norms and especially to the policy level. We want to be urging national governments to sign on to a commitment to say we are going to achieve 50% of men, 50% of women doing care work tasks within a certain number of years ourselves. And also that all of us at the social norms level start to think of this work as being 50% men and women. I hope that makes sense. Thank you for your attention on this quick overview. Back to you, Wessel.
Thanks, Brian. So Alexa, over to you for the launch plans. Alexa is the Director of Communications at Promundo. Please go ahead.
Hi, everyone. Thanks so much for joining today, and Brian for that overview. Just a few minutes from me here. I'd like to share our plans for the launch of the Global State of the World's Fathers. So as many of you know, we will be going live with the report at the Women Deliver Conference on June 5th. So that's just under 2 weeks from today. The conference at last check, I think they said was nearly up to 10,000 plus attendees. If you on the webinar are planning to attend, please feel free to shoot me a note and we'll be in touch with the plans for the launch. So our hope at the conference is to not only share the report with all of the journalists in attendance, where there should be several hundred, but also to be able to network with all of you and make sure that we get the report in the hands of organizations, nonprofits, government ministries that can use the report for their own advocacy and action after the launch. So on the day of June 5th, it will start at 7 a.m. local time when the report will be live. It will be live on stateoftheworldsfathers.org. That URL is currently not live, but we're relaunching the site with the new report. The current website is SOWF.men-care.org if you'd like to see the existing reports. At 7:30 a.m., we will be part of the breaking news press conference at Women Deliver with an estimated 200 plus journalists, where we'll present the report at the start of the day at the Women Deliver sponsored press conference. And then our launch event itself is at 12 noon. We are planning to live stream this through the MenCare Facebook account, so stay tuned for that. And I have an update on that launch event at the next slide. And at 4:30 that same day, Gary Barker, the president and CEO of Promundo, will have the opening remarks on a plenary panel with several thousand participants, where he'll also be able to highlight the report and some of its key findings. So at the launch event itself, we're thrilled to confirm the executive director of UN Women who will join us, the CEO of Unilever, as well as representatives from UNICEF, Plan International, and Ziadine Yousafzai of Malala Fund. We also just confirmed today that Liz Ford of Guardian Global Development will moderate for us. So we're very excited for that event. We'll be using #WorldsFathers. We'll also be able to share a launch bundle for those of you who are planning national launches with the report itself, as well as a PowerPoint and the other materials we'll be producing if you would like to share those at your national launches. And I can also share the press pack as well when we go live with all of the assets for you.
Thank you so much, Alexa.
Yes,
you want to mention
this
this?
is just a snapshot to show that there are launches planned from the UK to Sweden to South Africa and Brazil in the 2 weeks following. So if you're planning an event, please reach out and we can add you to the list. Thanks, Wessel.
Thank you so much, Alexa. So we're now going to go into particular experiences from Nicaragua, Sweden, Brazil, and Netherlands. A reminder to attendants, if you're posting questions, I'm seeing there's some questions already posted. Because we're now going to go through 4 presentations consecutively, please note the person that you are asking the question to, so that when we return to the question, we know who you are asking the question of, if the question itself is not clear about what the content is about. So let me go right into the presentations and introduce you to our friend and colleague Douglas Mendoza, who's the Associate Director of Development at Puntos de Encuentro. And he's going to talk to us about the use of the report in Nicaragua and in the border region. So over to you, Douglas. Thank you so much.
Hello, everyone. It's a pleasure to share this experience with all people around the world. Yeah, in Nicaragua, Puntos de Encuentro with the Country Network, Red Mass Men Engage in Nicaragua, we organize the meta launch in Nicaragua with different NGO, children right organization, youth organization, and different organization and member for the women's movement, with different press, radio, television, local, national, regional station. This launch organized with the government, with the child procurator officer and procurator office for women, the health ministry staff. In this meta launch, we present the the report for father around the world. We use different information for advocacy in this activity, this opportunity to introduce this perspective about the fatherhood, about parental leave, how to use this information for changing the public policy in Nicaragua, this opportunity for how to change in this traditional vision about the fatherhood in Nicaragua, in the region. This opportunity for use different material, because the Puntos de Encuentro country network in Nicaragua, we a fatherhood promotion program in health center in different part in Nicaragua, especially in the north part. We promotion the fatherhood program with the health ministry, and with this program we promote the research, how identify different barriers in the health center to implement the humanistic delivery standard to implement program P. With this research, we use it for organized trainer to the trainer in the health ministry in the north part of Nicaragua, and working with the different people working in the community. For this, the health ministry, they interested to organize the fatherhoods in the community, working with the health center in this part for implementing to program P. And we use this research for promotion the paternity leave in Nicaragua. We create the social media campaign around in Nicaragua and different parts, produce special material for father group, for the information for the health center with the health ministry, and use different experience for father about how to change in the life, participate in this and training in this program P. And we in country network with Puntos de Encuentro, the coalition, we use different experience for advocacy, because in Nicaragua the paternity leave in 6 or 10 years I was only to use 2 days, but no pay with the salary. And with this working with the health ministry and the change into the public policy in Nicaragua, in this moment we stay 5 days with the salary. The father is possible to take 5 days with the salary for participate with the childbirth in different spaces in Nicaragua. And in this moment, join work with the procurator officer with childhood for formation, sensitization for parents, for maintains demands in different parts in Nicaragua. Thank you.
Sorry about that, Douglas. Are you finished?
Yes, no. And the last minute is use this fatherhood report, use it to in MenCare America Latina. We organize different advocacy spaces in Mexico, Colombia, Panama, Nicaragua, Peru. I use this fatherhood report for promote the advocacy in the Latin American countries.
Thank you so much. Thanks, Douglas. Now we go to Sweden, and I'd like to introduce Tomas Agnemo, who's the Senior Gender Advisor at Plan International in Sweden. And Tomas will talk to us about the use of the report in Sweden and for broader advocacy in Europe. So welcome to you, Tomas.
Thank you, Wessel. I hope you can all hear me. Thank you for everyone joining this webinar on this very important issue. So I'm Tomas. I'm the Gender Advisor with Plan, as you said. So you can move to the next slide, please. So we did launch events in 2015 and 17, first one in Parliament and the second one with the Swedish Institute. And we're now planning the launch of the 2019 report as well. And we got a new government quite recently, so we have invited the new Minister for Gender Equality to that launch. And I think that's helpful to build relationships with politicians, because the report is global, so it will create some attention so that we can also reach the policymakers and the politicians on our issues, which I think is important. So this is a joint joint work with Save the Children and Men for Gender Equality to other Swedish organizations and Plan International. So I think one takeaway is that it has helped us to build alliances and networks in Sweden with like-minded organizations, but also with other organizations, because working with men and boys, it's a relatively new field. So we need to build alliances and create a space for the work we do on fatherhood and caregiving and other issues concerning men and masculinities. And also that we need to build evidence, because we cannot build our knowledge on anecdotal evidence. We need to have real evidence, which is really be good, especially with the first report from 2015 that was full of evidence that the work we do on fatherhood and caregiving is important for many different reasons, as we know. So in Sweden, we have a very generous parental leave system. And also, I think one important thing is also the subsidized childcare that we have in Sweden that has helped to a lot for gender equality, but still not so much fatherhood groups, for example. I think Program P, for example, that Promundo worked with in Latin America is much more active than fatherhood groups in Sweden. So with national advocacy, I think that's something we need to push to get more fatherhood groups into our system, whilst we already have a very generous parental leave system and also subsidized childcare. But still, there's a long way to go in Sweden, I think, to reach gender equality, because as we live in a patriarchal world, even Sweden too is a patriarchal world, even though we have a feminist government and which has gender equality in the agenda. Still, the root causes, I think, have not really been challenged so much in Sweden as we want them to be, so to say. So you can move on to the next slide, please. And then, of course, also, I used to work as a coordinator with Men Engage Europe, and the report has really helped Men Engage to open doors, I would say, and link to the European arena. At one point, there was like in between the European Union working with Men Engage Europe or with like more other organizations that were more not on the feminist side, so to say. So I think the report really helped Men Engage to be the network on the European level that the European Union decided to work with. And the report has created a lot of accountability, I think, for Men Engaged being the network to go to at the European level, working with, for example, the European Institute for Gender Equality and the European Union itself. And then I just wanted to finish with two important points, that we always have to be accountable to the women's movement, that the work with men and boys and masculinities and caregiving, it couldn't be taking resources from the women's movement, but we all the time have to work together, very closely linked, and see that we have a joint struggle to work for gender equality together. So we all the time have to listen to the women's movement and be accountable to them. And then also that we have a long way to go to change attitudes and norms on caregiving and also on emotional labor. I think from a Swedish perspective, we see more and more that men are gender equal in Sweden in principle, but then if we look into data and statistics, women are the primary caregivers and men are the secondary caregivers. So even though we have a very, very good system in Sweden with, as I said, generous parental leave and subsidized childcare, etc., still women are the primary caregivers in Sweden. So we really need to look into how can we start working with men and emotional labor and get men as well to be primary caregivers for their children that take the same responsibility as women take, which is not really the case right now. So that's all from the Swedish arena. Thank you.
Thank you so much, Tomas. Next, I'd like to introduce Miguel Fontes, who is the Executive Director and Chairman of the Board at Promundo-Brazil. And Miguel will share with us how the State of the World's Fathers has impacted Brazil's national policy, program, and advocacy on fatherhood. Over to you, Miguel. Welcome.
Thanks, Wessel. Thanks all for joining. I want to talk about the impact at 3 levels in Brazil: the policy, program, and advocacy. And next. And I just want to give a little bit of background of our participation at the World's Report. We also have our own report, Brazil Report, and we launched already 2 editions as well. And we expect to launch a 3rd edition in August this year on the 2018-2019 report. Next. And this is actually the cover of the new edition we're going to have. And different from the other two that we had, we will try to focus much more on testimonials, featuring stories of men's involvement as fathers from a diverse perspective. So we'll be talking about full-time fatherhood, challenges and joys of being a trans father, grandfather, same-sex parenting, adoption, paternity leave, Black men's fatherhood, special fathers, family planning, communications and fatherhood, and this construction of sexism and men's involvement in fatherhood and caregiving. So this will be a different approach from the previous reports we had, which was much more quantitative. And talking about the Afro-Brazilian, for example, which is a more specific segmentation we're having on this year's report, we talk about the Afro-Brazilians, but we also talk about a workplace aspect. For example, we have this statement from Afro-Brazilian who says to discuss Black men's fatherhood is to bring light to the exclusion of one people, and all this is happening before us. By celebrating the benefits of being able to raise your children well, think if you also give your employees the chance to live this. Think about who is around you or on your orders. So this will be interesting as an approach to really focus on new niches on discussing the fatherhood agenda. But talking about the history of the impact of the World Fathers Report in Brazil, at first we talk about the policy impact, and the next. We were invited, this is just an example, to speak at Congress in Brazil last February. So we had Gary participating here on presenting and discussing policies at Congress. And on the paternity leave, it's very interesting because we have already an 180-day leave for women. And there are two proposals going on to engage men. One is how to share between progenitors or adopters alternatively, and reserving the women the exclusive enjoyment of the first 30 days. And the other one, without prejudice to employment and salary, share up to 60 days of the period with her partner. So, you know, it's a decision of the couple of who they wanna reinforce as a caregiving at a certain time during the leave. And also, we are discussing with Congress new legislation to reinforce the need for engaging men during prenatal care. So this is a very strong agenda, the policy level. And what we're trying to bring at the policy level is the benefits to men and to economy. And this is a statement from Gary that was really disseminated in the media in Brazil, trying to focus on those benefits. So he said, we have seen in many surveys how positive it is for men and take care of the other, we take care of ourselves as well. Men who participate in care also report happiness and better relationships. It also seems to help us concentrate and enjoy work better. So this is the approach we're taking with Congress. So moving on to the programmatic impact, it was interesting that after launching the World Report in Brazil and the local report, next, we have been invited by the Ministry of Health to create a distance training module to health workers on fatherhood and caregiving. The name of the course is Promotion of the Involvement of Men in Fatherhood and Caregiving. And as a result of that, the Ministry of Health created another module targeting fathers on first childhood development. And as of February 2019, over 43,000 fathers have already been trained in Brazil. So moving on. We also, based on that very successful experience at the Ministry of Health, we have now been invited by the Ministry of Citizenship to do a similar module to social workers for the home visiting program they have called Criança Feliz program. Actually, Criança Feliz is one of the largest home visiting programs in the world. So this will be, we are very excited about that opportunity. Moving on, then thinking about the impact on research and advocacy, we have also been, based on the launch of the reports, been able to lead now a working group at the National Early Childhood Network on any issue that relates to fatherhood and caregiving. And we are co-founder of that early childhood network, which incorporates more than 40 organizations and going up. And we actually participate in the first national strategic plan for early childhood. But based on that network, we have a working group, and Promundo is now leading that working group because of the report and because we have the results of the report. Next. And to finalize, what is very interesting, very exciting, and maybe used in future reports, in a future report actually, is that we are already discussing with the Ministry of Citizenship the design of a national research on determinants of positive caregiving by fathers, especially in vulnerable sites. And we are already working on a research protocol, which should be finalized and submitted to ethics review by August 2019. And thank you. And if you have any questions, please let me know.
Thank you so much, Miguel. Much appreciated. Next, we move back to, we're bouncing between Europe and Latin America here. So we go back to the Netherlands, and I'm happy to introduce Kate van der Krol, who is an advocacy officer from Rutgers, who will talk about the experience from the Netherlands on using the report for national advocacy and some tips for using the global report. Over to you, Kate. Welcome.
Thank you, Wessel. If you could move to the next slide, that would be great. Because we have been just so enthusiastic about State of the World Fathers, because we've adapted it twice. In 2015, and now we're doing the same. So in 2015, if you could go to the next slide, we invited the social minister for the Ministry of Social Affairs to read and to take with him the Dutch adapted version of the international report. And what we really did was we used the new research on Dutch fatherhood, and we put it all in there, and we discussed topics such as sexual and reproductive health, care work, but also relationship with the employers. And we made really concrete recommendations, and that was that we wanted paternity leave. So if you could go to the next slide, Wessel. This event where we launched it was very drew a lot of media, and there was a lot of attention because it was the first time that a politician really showed interest in the topic. And if you could go to the next session, we really noticed that it really helped when we had targeted messages for the policymakers. So really concrete what you're asking for. And what we did was that we worked with a lot of partners. So not only partners that already work with men and boys, but also people that, organizations that are for women's rights, women's labor rights, children, daycares, unions. So we all brought them together for our campaign for paternity leave. And if you could go to the next slide. Our report, the report that we used in 2015 was one of the reasons that we actually got an extension, which is now going to be 5 weeks in 2020. And we're very happy with that. And it was partly because of the adapted State of the World Fathers. And if you can go to the next slide, Wessel. We're now 4 years later. So 4 years after the first report that we adapted, we're going to adapt it again. But now we're going to have to take another route. So last time we wanted a concrete change in laws and policies, which was paternity leave. And now that we've got the paternity leave, we need to really focus on the culture shift. So we need to make sure that men and fathers and caregivers will take up the leave. So the report will have a whole different set of recommendations and asks. So we'll be more focused on that, what Brian said, the fourth and the third slice. So really the changing of gender norms. And we have a set of recommendations which we made together with partners. So we're not alone as an organization pushing for this adapted State of the World Fathers, but we really can put all the logos and all the signatures of other organizations that stand by the new recommendations. If you can go to the next step, yeah. So this report that we're launching in, we're doing that in the week after Women Deliver, which will be the week before the Father's Day. And I could really recommend using this week to get attention for the report. And if there are new researchers, you can just all bundle them together and use the socio-ecological model to highlight the new research, because that's how we are doing it too. And if you can go to the next slide, so as you can see now, the main message of this year's will be that the legislation is in place, but that the legislation will not have any benefit to family if there's not a gender norm shift in the Netherlands, because a lot of men actually don't take up the leave that they have been given now. So we really need that culture shift, and that's why we use the International State of the World Fathers and sections of it to show what kind of cultures are there broadly, so worldwide, and which culture norms do we have in the Netherlands that still need to transform. And so at the last slide, we have our checklist. We made a checklist how to use the State of the World Fathers in your own country. So we really benefit from concrete recommendations, and this doesn't have to be paternity leave. This can be about how to talk to health professionals, what HR departments need to do in organizations, and you can really make it a media place or a media event if you launch it with the minister. And lastly, we noticed that a lot of young politicians are men and actually are becoming fathers. If you try to make a connection with them, they'll be really enthusiastic usually about the topic. So try to use that as a leverage. That's what really helped us. Thank you all for listening, and I'll go back to you, Wessel. Thank you.
Thank you so much, Kate, and just a big thank you to the panelists. You really stuck to the brief of speaking in 5 minutes, so we're doing really well for time. We have some time now for questions and answers, and I'm hoping that all the participants can see, or all the attendants can see the question and answer box. I've noticed that Brian has been answering some of the questions that were open in the question and answer box. But let's see, there's still two open questions. And the first one is also to Brian. So Brian, I know you're also typing. Brian just answered it. Okay.
Oh, yeah, I'm sorry. Yeah.
No, that's fine. Brian, do you want to let's give you an opportunity to just talk through not necessarily all of the questions, but maybe some of the points that came up, and just reflect a little bit about your answers. They're available for folks to read as well, but let's give you a few minutes to just speak about what kind of questions came up about the report.
Yeah, I hope this was the right move to type out some of the answers as well. But there were a couple questions coming in, and I think it relates to just having to squeeze a lot of information into a small time here. But one concern was about the 50 minutes, 50% campaign and commitment headline. And really the question of, is 50 minutes enough to call on men to increase the amount of care and domestic work that they're doing? And I think the point raised by the person making this question is absolutely correct, that in a lot of countries where we have data, that would hardly get us anywhere near to full equality in care work. So I think as we go on and start to use this commitment language and see how it resonates with people, we will certainly have to emphasize that this is an absolute bare minimum number that we would call upon men to increase in their care work contributions, that in a lot of countries around the world it wouldn't get all the way to equality, but we're also trying to have, for better or worse, kind of a catchy, concise headline that can get people's that can reinforce a lot of the messages all at once and help everyone from individual men and women all the way up to national policymakers conceptualize kind of something concrete that they can start to work on, whether in their at all 5 of those levels, whether in their individual, family and couple contributions, or in making national policy. A minimum of 50 minutes as a start to not only increase men's time, but also reduce women's time. That's a key part of that number as well. We've seen in a lot of studies actually that even when men have increased the amount of time that they're spending on domestic and care work, it can sometimes be in some of the more masculine gendered tasks. Maybe they're just spending more time playing with the kids or helping with homework or doing a little bit more discipline. But meanwhile, the care for sick members of the family, the cleaning, the doing the dishes, the cleaning of the bathroom, the planning for the hospital visits for the children or for other sick members of the family, a lot of the work that amounts to that full time that women are contributing, those aren't actually the tasks that men are taking on. And we're not trying to be so prescriptive that we tell every single family exactly how they should share everything, of course, but that 50 minutes number also is meant to imply a reduction in the amount of time women are spending. So to the question asker, I hope that helps a little bit. And also a really important point that even though we talk about fathers in the headline to the report, and that implies, childcare, being a parent, and perhaps inadvertently I've used the phrase childcare first and foremost in discussing the findings of the report and its messages. I think the question made it a very important point that when we're talking about care work, it's not just about children. I mean, there is a whole range of domestic work in the home, these things that make the home function, the cleaning, the cooking, the making appointments, the fixing things in the house, the fetching water. And we know that a lot of those tasks are predominantly undertaken by women in unjust ways, in addition to childcare. And so when we're using the word care work, it's meant to relate to all of those things, not only to childcare. But those are really good questions that kind of keep us on a principled basis about the way that we're talking about these things. I hope that helps a little bit.
No, thank you so much, Brian. So, Brian, there are a few questions that are revolving around the same theme, and I'll give the first part of the answer, but it'll be nice if you can also chime in. Which is about country selection and which countries are represented in the report at the moment. So there's a there's a question about, the first one is about whether the report is being utilized in the African region. And just to say, the first report very much included, especially the demographic health survey data that the team could find for African countries. So in that very first thick report, there was enough for us to be able a shorter version, which is called The State of Africa's Fathers. That was in 2015, and that is in the resource section of the MenCare website. That it's also posted on the State of the World's Fathers website. But and so for this report, we do have from my last reading of the draft, and you can maybe tell me, Brian, we do have a spread of countries, but only some have particular data. So there is more anecdotal or qualitative content or case studies from a spread of countries from Africa, Latin America, the rest of the world. But maybe, Brian, just give us some insight to how we decided which data to talk about and which are the best documented in the report.
Yeah, sure. That's a question we always get, and the dream, of course, would be that we had the resources and the time to conduct really deep, rich, new research in every single country, every single region all around the world, but to produce a report on an every 2-year basis, it's difficult to achieve. That said, we're always trying to have the broadest possible reach that we can, and we're taking the best opportunities that arise within the last couple of years as we produce a new report. So I can speak very precisely about the countries covered by the new data. So like I said, the Helping Dads Care Research Project, which produces probably 10, 12 new figures of data in the report, was funded by the Unilever Dove Men Plus Care brand. And so, in working with that partnership, it's to be expected that they would have particular interest in the countries and in the economies where, that brand exists and where they're selling their products. And so for that particular data, it's pretty much all middle and higher income countries. We have Argentina and Brazil coming from Latin America. We have the United States and United Kingdom. We have Japan. And we also have in Europe, the Netherlands, and I forget one more. Canada. We have US, Canada, UK, Netherlands, Japan, and then in Latin America, Brazil and Argentina. Now, obviously, that is not a global set of countries, certainly, and we would never present it as such when we show those data points. We're always referring to them as this particular selection of middle and upper income countries. Okay, the next one is the Plan International Canada. Like I said, they went and did deep conversations with participants in their fathers clubs, and also the female partners of men in the fathers clubs and their children. And so this is, of course, again, limited to this particular partner's reach. And the fathers clubs are ongoing in something like 5 or 6 countries, but they chose for us the following 4 countries where they undertook this new collection: Bangladesh, Ghana, Haiti, and Nigeria. So we're getting a little bit of South Asia there, Caribbean and Haiti, and then a couple countries in Sub-Saharan Africa, okay? In West Africa specifically. And then when we come to the images data set, this is starting to be a little bit more broad at this point between Promundo-UN, the Partners for Prevention study, all these partners who have done images or kind of images-inspired studies. We have 43 countries now, and we're presenting as many of those countries as we can in the report. And those reflect Sub-Saharan Africa, Latin America, even East Asia in that Partners for Prevention study. We have now 5 or 6 countries across the Middle East and North Africa. So I hope I'm making sense that we're taking the best opportunities that we can based on what partners kind of offer to us and the existing data sets that we have. Now, those are only specifically speaking to the new unpublished data that we are kind of releasing anew in this report. But when you see any of the past reports or this new one, you'll realize that the entire body of the report is drawing from other global sources. It's really meant to synthesize the current state of knowledge about equality and care work worldwide. And so there's every possibility that the country that you're particularly interested in would be featured elsewhere in the report based on kind of the current status of the literature. And yeah, I'm sorry. Go ahead, Wessel.
No. Thank you so much, Brian. And I wanted to also mention in the line of what you were saying about the images research. So we've just seen images Uganda being launched, images Tanzania was launched by Promundo and partners last year. MenEngage Africa, and with the MenCare campaign, we are supporting countries to do more particular country-focused reports. So we're also working on the state of Uganda's fathers, the state of Tanzania's fathers, and last year we did the state of South Africa's fathers. I can see in the chat box there's also a question where Shanoy is asking, in the event our local network can engage university students, would MenCare be open to working along with them to implement the same research in their own countries? I think, that's something that's been really exciting, and it's really nice to see how the global report has stimulated national reports. And I think certainly, we would be able to share lessons from the different national reports and from the global reports. I wanted to maybe just check, since we have some minutes, if there's any other comments from Miguel or Douglas or Tomas or Kate in closing. And then I'd like to ask Aapta just for 1 or 2 comments before we complete the webinar. Or Alexa or anyone. Are there any other comments from the panelists?
Hi, Wessel. This is Miguel. Can I make a comment?
Please. Sure.
Okay, great. Now, it's just to reinforce, that the World Fathers Report provides us with an overall look of what's going on internationally. But at the domestic level, it's very important that we don't have like a protocol that will be working for every single country. As I could see, for example, of the paternity leave issue, Brazil, we are talking about the 180 days that it's already offered for maternal leave, and and we already have 8 days for paternal leave. So we are trying to go beyond that for core responsibilities, and we are thinking about these niches, new niches, dealing with specific characteristics, social demographic characteristics of Brazil. So it's always very intriguing when you work in a country, how different it can be also, even though there are issues that are, we can really see the similarities of these issues. For specific countries, always have these specific opportunities and also threats to advancing the agenda of fatherhood and caregiving. So it's just an overall comment based on when we talk about countries, we always like to also make comparisons and look at numbers and so on. But with this new edition that we have in Brazil and really focusing on testimonials, we found how diverse it can be, that the numbers alone does not provide the insights that that are necessary to really capture the full picture, especially for vulnerable populations. So the recommendation that we have is always, if you cannot do a country report, at least digging into looking at specific villages, communities, and trying to understand what is the state of villages, fathers, of the city fathers, or whatever. It's very relevant and very, very important, because I think that's what makes a difference when we get to the programmatic level and the policy level. So just an overall comment.
Thank you
so
much.
Issues that were raised. Okay.
So then let's go to Thomas for one final comment before we close.
Thank you, Wessel. Yes, Plan has developed new models on men's engagement in early childhood development, ECDs, that we're just now launching internally in the organization. And I think the work with State of the World's Fathers and MenCare has really helped us to push the work on these issues inside our federation as well, because I think as a global federation that we are, I think it's also important to acknowledge that we can do a lot globally together. And we had an event with this new material last week, and it was obvious that no matter your context, if you're from Indonesia or Stockholm or Sweden or whatever, where you are based, the issues are more or less the same, though we have different systems in our countries. I think we have a lot of things that are global as well that we can discuss. So I think that could be maybe the topic for another seminar, how we can work with this globally. Thank you.
Thanks, Thomas. And then Aapta, please, let me pass to you for a kind of a closing announcement.
Sure. First of all, thank you everyone for your presentations and your participation and your wonderful questions. We're so grateful to be able to work with all of you and be able to share this this amazing report with you guys, and also being able to build upon it and really hopefully create a lot of really fundamental and necessary changes in our communities. Just kind of one last wrap-up comment is that as with other reports and tangent with other reports in the previous years, we will be hosting a MenCare global meeting coming this fall, November 2019. I think that some of you may have already received the save the dates. We're actually going to be, just a note that we're going to be actually moving the dates from to the week of November 19th, 20th, and 21st. Currently with a centralized location in Morocco, but actually one really exciting note is that we are going to be looking into promoting remote access, meaningful remote access for different partners to be able to participate, live stream at the global meeting without actually having to travel to Morocco if for whatever reason, voluntary or conscientiousness, they decide not to. So we'll be following up with more information about the details of that conference, but we're really looking forward to being able to build off of this report and create a really strong international agenda to move forward on not only paternity, expanding parental leave, as well as different engaged fatherhood initiatives, but also linking with other different sectors, including early child development, a lot of the climate justice initiatives that are going around in the world, childcare, parental parenting kits, etc. So we will be working to send out those details soon, but we look forward to seeing you in Women Delivered and to speaking further.
Thank you so much, Aapta, and just a closing vote of thanks and appreciation for especially the work that Alexa put into preparing for this webinar. It's really amazing considering the amount of work that's going into the launch of the State of the World's Fathers report that, Alexa, you were able to coordinate this webinar so well. So thank you so much for that. And thanks everybody for joining. And yeah, see you, online, see you at Women Deliver, and see you maybe in Morocco. Goodbye and good luck with all of the work that you're doing. Thank you so much. Goodbye.